To show you something that I see over and over again in my male patients. On the surface, they look great. They train, they have muscle, and their very basic labs appear normal. But when you look deeper, the male-dominant metabolic pattern is showing up. First, fasting glucose. This is 94. Most labs and providers will call that normal. I don't. Optimal fasting glucose should live somewhere between 75 and 85. And here's what most people don't know. Studies show that for every single point your fasting glucose rises above 90, whether you're male or female, your risk of developing diabetes increases by 9%. So at 94, that's already 36% higher metabolic risk trajectory. Not yet diabetes, but definitely metabolic strain. And his fasting insulin is elevated too, meaning his body is producing extra insulin just to hold that glucose there. That's early insulin resistance. And here's where it gets interesting. His genetics actually predict this pattern. He carries variants or SNPs that predispose him to compensatory hyperinsulinemia, meaning his body is wired to push out more insulin to try to keep that glucose normal. So even when labs look fine, this is a system under pressure. Second, inflammatory lipid patterns. Total cholesterol doesn't tell us our story. His LDL particle number is high. He has small, dense LDL pattern B, and his Lp(PLA2) is elevated, meaning active vascular inflammation. And again, his genetics support this. He has variants or SNPs associated with poor omega-3 conversion and higher inflammatory signaling. So he's not genetically prone to high cholesterol, he's prone to higher inflammatory cholesterol particles, and that's very different. Third is the omega status. Omega-3 index is 3.8%. We want that above 8%. The omega-6 to omega-3 ratio, 11.7 to 1. We want that under 4 to 1. That ratio tells me that his cell membranes are rigid and pro-inflammatory. And genetically, he doesn't convert plant-based omega-3 efficiently. So if he is not intentionally consuming EPA and DHA, he's going to fall behind the mark. So this is what I call that modern male metabolic patient. Glucose is creeping up, insulin is trying to compensate, we see inflammatory LDL particles, and we see poor omega protection. And the genetics are only amplifying the signal. So this is going to happen years before disease shows up. I always say disease is rooted in inflammation. So we don't wait for the diabetes, we don't wait for the heart disease, we correct those patterns because your genes will load the gun, but your lifestyle is pulling the trigger.